So here, few materials I'm going to review, and this review classes only for 7 days. Within these 7 classes, I am able to review from beginning to ending every chapter by chapter and subject to subject. Because these 7 days, I like to focus only the materials what students know. Some of the students work so hard, but they do not know what they should know. In these 7 days, I like to focus very basic, very fundamental, and important only for NCLEX. If you practice the questions that I provide, and with this 7 days review, I believe it is more than enough to get your license. I always encouraging students work smartly rather than to work 24 hours, you study. At the end, you do not get your license. So here, first of all, we categorized important stuff as the tools. There are 10 tools. Tools number one, Maslow's of need. According to this need, physiological need always before psychological. So we can see there are 5 steps. Number one, physiological needs or survival needs, security needs, belongs needs, and also esteems and self-actualizations. So the basic physiological needs are probably fairly apparent, and this include the things that are vital to our survival. And some example of physiological needs include food, water, or oxygen, elimination, physiological and mental rest. Let me explain something. So if we want to survive, we need to eat. We need food and water. And then we need oxygen for respiration. Now you have to ask me why I need this for my NCLEX board. NCLEX will not ask me the question food or water or oxygen. How can I apply this Maslow's law in hospital? Most of the students know the Maslow's law. They know what are the step-by-step process, physical need, safety, belongings, esteem, but they do not know how to apply it. As I told you, NCLEX board will not ask me the question about the food or water or oxygen, but we know it is the first physiological need according to the Maslow's law. How I apply this law for my patient. I am sitting here, I'm talking with you. You sitting here, you interact with me. What you need, what I need right now. We need some food to get energy, then we're sitting here. But when a patient in hospital, what he or she need? What are the first priority for the patient? It depends on need. If patient got hospitalized because of pain management the first priorities. If patient has a shortness of breath, less oxygen, give them oxygen. Oxygen is the first physiological needs. If patient got hospitalized because of head injuries and active bleeding is there, so stop the bleeding. This is the first physiological need. So when we work in the hospital, when we assessment the patient, we should find out what are the first priorities. And that is the, according to the Maslow's law, this is physiological need for that patient. right? When you have enough food or oxygen, we need the safety or security needs. So emotional and physical safety, right, come next. And they said protection from the any kind of harm. So we need shelter, we need home. When you have enough food, oxygen, water, and safety, you need belongs need. So belongings is the forming the relationship, basically, like adult role. I mean, adult persons need to stick with spouse, friendship, groups, peer relationship, all is belongs. And then we go for self-esteem need, positive, I mean, example, the positive classroom culture present, positive feedback, time for reflection, encouragement to take the risks, right? And also self actualizations. When we have all of this, then we go for self actualizations. So securities is second. So as we move up the second level of Maslow, this should be requirements start to become a bit more complex. At the level, the need for security and safety become the primary. And next here, if the physiological needs have been met, next highest priority is safety, home. What next? Next here, talking about the Eriksson theory of development. So Eriksson theory of development. So Eriksson believed that the 8 major conflict must be encountered during a lifestyle, and that there are the 8 developmental stages, each with the tasks that is to be achieved, and that characterized a person struggle with each of these conflict. Either a person successfully resolved the crisis and masters the tasks at hand, or does not. So if I ask you, what are the psychological developmental theory? It is the Eriksson theories. So Eriksson theories is a psychological developmental theory or prospect that our personality development through the 8 stages from infancy to the old age. So Eriksson psychological development theory processes that throughout our lives, and we encountered certain crises that contribute to our psychological development. And the scientist Eriksson presented this crisis as at 8 stages of psychological conflict, often known as Eriksson theory or Eriksson stages, right? Like during the infancy, 0 to 8 months, they talking about the trust or mistrust, unsuccessfully resolution of crisis, difficult to relating to the peoples, suspiciousness, fear of the future. And during the toddler, 18 months to 3 years, is autonomy and shame. Preschooler, particularly initiatives and guilties. School age, particularly sense of inferiorities, difficulty of learning or working. During adolescence, confusion about the self, identity, or submerged in relationship or group memberships. Development, a sense of identity is important. Early adulthood, emotional isolation, and establish the intimate bonds of love and friendship. In the middle adulthood, 35 to 65, self-absorptions, inability to grow as a person, and fulfillment of life goals that is involve the family, career, society, and volunteering. And let's say 65 years old to death, it is dissatisfactions with life, looks back over one's life and accepting its meaning. Next here, the nursing process. So what is nursing process? And this process consists of the following. Okay. So number one, assessment. 2, diagnosis. 3, planning. 4, implementations. And number 5, evaluations. So we can easy way to remember this, like AD, E, I, E, AD, PI, right? So A stand for assessment, D stand for nursing diagnosis, and P stand for planning, I stand for implementations, and E stand for evaluations. So if you remember at PI, it would be easy to remember all of the materials. What next? Okay, now next we so during the assessment, first of all, assessment is always done by RN, right? But LPN must understand the process because LPN also participate to data collection or critical care. So after this, we have to collect all of the data, right? So particularly data collection, history taking, subjective data, and objective data. Subjective data means symptoms experienced by the client. Like patient said, I have a sore throat, or I have a abdominal pain. Objective data means what is measurable. You can watch, you can touch, you can smell, you can feel. Also, vital sign is a best example. Then confirm that data collections and also communication important receive the assessment. So assessment, they say that assessment is the nursing assess the patient on the depth of physiological, economics, social, and lifestyle basis. Then diagnosis, like careful consideration of both physical symptoms and patient behavior. The nurse make a diagnosis, and this is called nursing diagnosis. So first of all, identify the actual or potential healthcare needs and problem-based of your assessment. Also interpret the data, validate data, organize data, determine if there is a need for more data collections. And finally, in this phase, the nurse used data for formulate the nursing diagnosis. Then we have to go for planning or outcomes. So the nurse used their expertise to set the realistic goal for the patient's recovery. So this is done to provide client care consistently and approximately. Ask yourself the following questions. What is the priorities for my patient? How does this determine the client needs? And how will this affect the care the client is getting? And this is when the nurse determine the goals, formulate the outcome criteria, develop a plan of care, and collaborate with other healthcare professionals. And this is called interdisciplinary approach. Then we go for implementations. So to obtain to do something and then doing it. Like prepare, counsel and teach, perform. After care is performed, record and report. So prepare means organize the client care, gather the equipment and explain procedure to elicit. Counsel and educate. So to direct at the client and their family members, significant others, and others member of the healthcare team. Perform, follow the procedure, infection control, and always we follow OSHA guidelines, monitor the client response to care. After care is performed, make the client comfortable, and then replace any equipment no longer needed. Record and report. Document everything accurately. The LPN report findings to the RN. And RN report any abnormal findings to the healthcare provider. And finally, evaluations. So evaluate the plan. If the plan can meet the goal, we can continue and patient will be feel good and they will be ready to discharge. If patient force, we need to change the planning. Maybe need to transfer the patient to other unit. So evaluate basically, has needs been met. Compare actual outcome and expected outcomes. Reevaluate the problem, right? And also reset the healthcare teams. Like a patient admitted to the hospital because of fever. And patient said the fever is more than 10 days. And you decide maybe the fever because of urinary tract infection. And you culture the urine and gave the antibiotics. And these antibiotics for 7 days. So you expect after 7 to 8 days, your patient will be cured, right? So this will be cured, I said. So this is actual outcome, that after 7 days, my patient is good, expected outcome. So if patient feel good, means the patient met the need. So if patient do not good after 7 days, maybe any other underlying cause, we need re-evaluate. We need change the antibiotics, or we need further investigation. So re-evaluate, right? And reset, need change the antibiotics, or need to refer to urologist or other specialized doctor, healthcare team, work together. What next?